Well, Dr. Kahn, I can tell you it is such an honor to be talking to you.
Thanks for the invite. I truly appreciate it.
Yes, of course, of course. Yeah, we are so excited to talk to you in today's Fireside Chat. We are honored to welcome Dr. Mark J. Kahn, Dean of the Kerkorian School of Medicine at UNLV and Vice President for Health Affairs, to today's Fireside Chat. A distinguished leader in medical education and healthcare, Dr. Kahn brings decades of experience as a hematologist, medical oncologist, educator, and innovator. Dr. Kahn has held prominent leadership roles with esteemed organizations, including the Association of American Medical Colleges and the National Board of Medical Examiners. Before joining UNLV in 2020, he served as a senior associate dean at Tulane University School of Medicine, where he developed groundbreaking programs that integrated medicine, business, and community service, such as the MD-MBA dual degree and a public service-focused BS-MD program. An accomplished scholar and author, Dr. Kahn has published over 100 peer-reviewed manuscripts, authored 5 textbooks, including Business Basics of Building and Managing a Healthcare Practice, and contributed to more than 110 book chapters. His dedication to advancing healthcare finance and medical education has earned him recognition as a Master of the American College of Physicians and as a Fellow of the Royal College of Physicians of London, one of the oldest medical colleges in England. Dr. Kahn's passion for expanding access to healthcare, fostering economic growth through the academic medicine, and inspiring future generations of healthcare providers resonates deeply with the mission of the GVHS Medical Society. We are excited to learn from his journey, vision, and insights as we work towards addressing the challenges and opportunities in healthcare today. Dr. Kahn, thank you for taking the time out of your demanding schedule to engage in a fireside chat with the GVHS Medical Society.
No problem. Thank you for the invite.
Awesome. So yeah, we'll get started. My name is Brianna Shaw, and I'm the president of the GVHS Medical Society. My first question is about standing out in admissions. Beyond the standard educational background and MCAT scores, what qualities or experiences do you believe truly set a prospective student apart when applying to the UNLV School of Medicine? Additionally, does the admissions process place particular emphasis on students who are born and raised in Nevada, recognizing their potential to contribute to addressing the local healthcare needs and shortage of professionals?
Yeah, so thanks for the question, Brianna. So we were approved by the state legislature back in 2014, really, as we say it, to care for the community. So to best do that, we're going to want to train physicians who are going to want to eventually practice in Nevada. Critically important. So because of that, greater than 90% of our students are from Nevada. And the smaller percentage that aren't tend to have a close connection here. Family, relatives, frequent visits. They went to UNLV undergrad, all kinds of things. So we want there to be some connection. So yes, we give strong preference to people from Nevada. The second thing, though, that you asked is, what do we look for? We really look at a lot more than test scores. We look at the journey traveled. And we want to see that people, what brought you to this point? What adversity have you faced? How have you stood up to adversity? And what gives you grit or strength? Really important. When we look at our students, about a quarter to a third are first-generation college students. And again, that's because of our commitment to care for the community. We want to train a group of physicians that, as closely as possible, mirror the population that they're going to be taking care of. Again, we use MCATs as a threshold, below a certain level, we're not comfortable that you'll be able to get through school, but we don't use it for much more than that. So we don't say that somebody with a 520 is a better applicant than somebody with a 510. They're both, or 505, they're both okay. So that's so it becomes it becomes really a dichotomous variable, yes or no, not a gradual graded variable, continuous variable. Grades, similarly, we know that sometimes folks struggle their first year, especially folks that are first generation college students. So we look at the total picture and the total journey traveled. Really important. Oh, one thing I should say, and that is that medicine's a service profession. So we want to see the folks that we're bringing to medical school, we want to see experience with community engagement and community service. That's an important mission of ours, and it's an important aspect of our medical student classes.
Wow, thank you for that great answer. And I completely agree. We did have an event at my school where you and our School of Medicine came to visit us and kind of give us some information about admissions in medical school. And he did mention that it is a lot more important than just your grades and your MCAT, because the way that society is changing, that we need more diversity. So I feel like their medical school applications really want to get to know you as a person as a whole. Your grades and your MCAT isn't as important as, like you said, your community background, your service background, and also the experience that you've been through, such as volunteering at hospitals. How much exposure do you have in a hospital in medicine?
Yes.
Yeah, awesome. Thank you.
My name is Aaliyah Preciado, and I am the GVHS Medical Society Social Media Director. And my question is on the business of medicine. So you've emphasized the importance of business education for medical students. How do business skills empower healthcare professionals, and what key skills should aspiring providers develop early in their education to thrive in a modern healthcare environment?
It's a really good question. So, healthcare is 17% of our gross domestic product. So it's a big part of our economy. So medicine is in many ways a business. And I have a colleague and friend who coined an adage that I use a lot, and that is that good medicine is good business, but not necessarily the other way around. And I think, and by that he means if you practice good medicine and take good care of your patients, that will pay off from a business perspective. But if you solely concentrate on a profit margin, that does not necessarily lead to good medicine. So it really is kind of one way. The problem is that for many decades, physicians abdicated the business part of their occupation to other people. And when you do that, you lose that sense of mission, and you lose that sense of purpose. In 2024, we're seeing a lot of medical practices being bought out by private equity firms, and private equity's mission is to generate profit for their shareholders. In fact, they like to generate 20% at least in 5 years. And if that's your focus, you're going to leave the care of the patient, unfortunately, behind. So we need to train physicians who have knowledge and a sense of this so that they can use business acumen to provide the best care for their patients and use business arguments to get that care for their patients. For example, there are federal programs that assist paying for certain medications for folks who are otherwise unable to pay. Using those programs, you could develop a very good business sense for why you want to take care of that population of patients. And if you can make a business argument, people are going to listen. But you got to have some business skills to know how to put those sorts of plans together. So it's critically important. The other truth of this is that, physicians are generally well paid, and you have to know how to manage your own finances so that you can, again, maximize value to your community in which you work. I encourage folks that work for me, you gotta give money away, and you gotta give a percentage of your money away. And really, the better off you are, the more money you give away for the betterment of the community. So it all is sort of in this ecosystem that really is critically important.
Well, thank you so much. I didn't realize how important knowing business skills was in the medicine field. Like you said, medicine is business, but just focusing on business doesn't mean you're going to provide good healthcare. So I think it's really important to know that where that line is, where business is affecting like the medicine, healthcare. So thank you.
Yep. Thank you. Thank you.
Hi, my name is Elham Youssef, and I am one of the members at GVHS Medical Society. And my topic question is on leadership and legacy. So, having held prestigious roles and received numerous accolades, what has been the most impactful decision or project in your career? And as a leader, how do you define success in medicine, both for yourself and for the field as a whole?
Thank you for the question, Ellen. So I think the most impactful decision I made was to come here. We're a community of 2.5 million plus. We've spent the past 20 minutes or so talking about many things that we don't have that we should have and deserve, and to have the opportunity to not only create a newer medical school, but also to help shape healthcare for a community is one that you seldom get. So that's been very impactful. I think when you look at events that happen in your life that are meaningful, from a leadership perspective, when I was 14 years old, I lied about my age and got a job in a restaurant. And then I became a manager when I was 16 or 17. They didn't know how old I was, but I had an early opportunity to manage people. And I remember the dishwasher was 52 years old. It was like the oldest person I'd ever seen. Right, so that becomes impactful. When I went to college, I didn't have a lot of money, and part of my financial aid was work study. And I got a job in a medical lab and did research and started out washing glassware, but then got a project and published my first paper. And that was really impactful and turned me on, excited me about a career in academic medicine. And then, in 2005, August 29th, a day that people who live in New Orleans will never forget, Hurricane Katrina hit New Orleans. And I was there. I was on the faculty at Tulane. And when it was clear that the levees had breached and that our city was in trouble, I had evacuated to Houston, Texas with my family, and I called people at Baylor College of Medicine because I knew that they had been through Tropical Storm Allison, and I asked them kind of what they did and asked them if they could take some of our students, and that notion snowballed, and we ended up moving our entire school 350 miles away to Houston, Texas for the entire year. And I learned more with that planning process in that year than I've ever probably learned, because we didn't have internet for 3 months after the storm. So how do you communicate with your students to talk about what you're trying to do? And how do you know if your students are even okay? So our students at the time, this was in 2005, knew about Yahoo chat groups that we quickly learned about. And that's how we communicated with our students. And how do you put a school together from scratch after a major disaster? And going through that process, I just learned an incredible amount. The bottom line, the punchline is that we were ready to start classes 2.5 weeks later. We were delayed by a hurricane that came to Houston called Hurricane Rita. So we waited a week. We had classes. We that year graduated a class, recruited a class, and matched a class into residencies while really being in Houston, Texas, again, 350 miles from home. So it was very successful, but there were times when we didn't know if what we were trying to do was going to work. And people said, look, we admire what you're trying to do, but no one has ever done this before, right? Like this has never happened, but we did it and we got it done. So when you go through something like that and you realize what can be done, it gives potential and gives you courage to say we can make this work. And looking at the healthcare that Las Vegas needs, there's a lot that needs to be done. But I know that if you get people working together and you get people focused on a mission, you can get closer to that goal just with that type of focus. So a couple valuable life experiences. And then I think you asked me about legacy. So my legacy is simple. When I'm done with this job, I want to be able to tell you that healthcare is better when I'm leaving than when I came. It's that simple. That's what I want to be able to say. And it's not just because of me, because these things take teamwork and they take lots of people. And this healthcare is really a team sport, and this requires a team. So.
Well, thank you so much. That was really insightful. I really loved and really wanted to emphasize the point where in Nevada we have young people who are questioning whether or not they want to join the medical field. And I think people who are in leadership positions who have gone through hard times and who have experienced these situations, we should be able to uplift everyone in our community, to encourage everyone, especially young individuals who are now currently thinking about what to do with their life. I think it's very important and very critical for us to, as leaders and as people in these type of positions, to also really create an emphasis and just draw the point where going through hard decisions and hard life choices in life doesn't mean it's a negative point. It also helps you become a leader, and it helps you become a better version of yourself, not only for you as a person but for people in your community to help you. And I think it's essential for healthcare organizations to have strong leaderships in place to guide decision makings and to ensure the safety of patients and staff. So I really appreciate your response, and thank you so much.
Thanks.
Hi, me again. So I will be kicking off our final question of this fireside chat. My question is about the future of healthcare education. I founded the GVHS Medical Society at my school last year, and with the help of my awesome executive board and Diego Trujillo, CEO of Las Vegas Heals, we've already grown from 1 school to 4, with an initiative supported by the Clark County Medical Society chairman to expand to all CCSD schools. Through Diego's connections, we've had the opportunity to engage with expert physicians, tour healthcare facilities, and offer hands-on experiences. As aspiring physicians, what advice would you give to us to further foster a passion for medicine among our peers and inspire the next generation of healthcare providers in Southern Nevada?
So first, let me say congratulations on your accomplishments, Brianna. That's a lot in a very short time. But I think, when you think about medicine, it's a great career because seldom you have the opportunity to change people's lives. And you get to do that in healthcare and you get to do that in medicine, whether it be to patient care or administration or policy. There's just lots of ways that you can make life better for people. As a personal story, I am a hematologist oncologist, and there are certain patients that you remember, but I remember a young woman when I was still in training as an oncologist, and she came to see me and she was about my age at the time, 30 years old or so, and had beautiful long hair, and unfortunately had a cough and was found to have a large mass in her chest and had lymphoma. And I talked to her about how we were going to treat her lymphoma. And I talked to her about how, unfortunately, most patients that go through this treatment lose their hair. Now it'll grow back, but she had long, beautiful hair. And I also explained that there was a reasonably high likelihood of infertility then. We didn't do oocyte preservation like we do now. So, and that was unfortunate because she was newly engaged and wanted to start a family, but she knew she had a life-threatening illness. So she went through a treatment really swimmingly and did very, very well. Her tumor disappeared, and she was one of the few people who actually did not lose her hair. And every year for a couple years thereafter, she'd send me pictures, and one was of her wedding ceremony. And then progressively each year, there was she and her husband with yet a new baby. So she eventually had 4 children. So you think about that, and you take care of somebody in perhaps the most vulnerable time in their life when they are really facing life and death. And you can treat them and work with them and actually subvert death, if you will, and allow them to live a normal, productive life. And there are few careers that allow you that opportunity. So when I see young people that want to go into medicine, it's not perfect, and it's not going to be the same 10 years from now as it is today. And it's not the same now as it was 10 years ago. But it's still a field that's going to give you great flexibility in what you do. And it's going to give you an opportunity to change people's lives. And to some extent, there's really nothing more noble or important than that. So that would be my recommendation.
Wow. And I really do agree with what you're saying. I want to be an OBGYN. So I definitely do prioritize being a nurturing person, because no matter what kind of doctor you are, most of the time, if someone's coming to you, they're probably going through, like you said, a vulnerable time in their life. So it's always good to kind of just put things in perspective, not always doctor mode, but also seeing people as people. And sometimes just being a little bit nurturing, a little bit encouraging can make all the difference. And yeah, no, I really agree with that. And I'm definitely going to take this advice as I go through my medical journey through medical school and becoming a doctor. And yeah, I think that wraps up our fireside chat. Dr. Kahn, I tremendously thank you for speaking to us. This was very insightful. I think we've all learned a few things. I know I have. And yeah, this was a wonderful meeting, and I really appreciate you once again for taking the time to speak with us.
Thanks,
Yeah,
Brianna, Ellen, Aaliyah, Basil, and the rest of the group. Good luck. Stay focused, and remember, this is a great profession, and I hope to see you at our school in a couple of years. Thanks.
Yeah, of course. I just got accepted to UNLV Honors College. I'm going to I'm starting with the service learning, and then I'm going to transfer to research, to their research program. So I hope to see you around.
Good. We look forward to it. Awesome.
Sounds good.
Good luck, folks, and happy holidays.
Thank you. Happy holidays. Bye-bye.